All right, welcome back, Bartow County. We're so excited to be joined today by Brian McDaniel, who is the Executive Director, Georgia Operations for Blood Assurance. And this is part of our For Bartow video series where we are talking to chamber members about things going on in our community, whether it be related to the pandemic or not. It's just fun to kind of catch up with everybody and see what's happening. But we're going to have some pandemic COVID-19 related content today. And so I want to welcome Brian and start by asking, I know we've had some questions and I too have wondered at times, are you still taking blood donations at Blood Assurance, and is it safe? So let's start there, Brian.
All right. Well, thank you for having me, Cindy. I appreciate you very much for showcasing us today. We appreciate the opportunity. And the answer to that question is yes, absolutely. The need for blood didn't stop because we shut everything down for COVID. The need continued. People still had accidents. People were still ill in the hospital, those kind of things. So we continue to need blood. And in fact, over the last 3 weeks or so, we've used anywhere between 20 and 15% more blood this year as compared to the same time last year. So the need is very great. And unfortunately, we just haven't been able to collect the amount of blood that we have in the past because schools are shut down, businesses are closed, businesses don't want to bring outside people onto their campuses and take any risk. And so it's caused some problems for us in getting blood. Fortunately, our centers have been fairly busy. People have been coming in. We've been blessed to have people show up and donate blood on their own. So we encourage people to do that. We have our center in Main Street Shopping Center, 334 Cherokee Place, right between TJ Maxx and Publix. We're open 9:30 to 6, generally Tuesday through Friday, but all through the month of June, we're going to be open on Mondays as well. And then we're open on Saturday from 9 to 3. So plenty of opportunity for people to come out to our center and visit us. All through the month of June, we're giving away a nice t-shirt for June. And then people that bring a friend with them and get them to donate have the opportunity to be entered to win one of 3 Big Green Egg grills. So very pleased that we're able to offer that.
I saw that, yes, and I will say that's great about the Big Green Eggs. And I will say the t-shirt designs, I look forward to seeing what each month, I don't know how often it changes, but they are so awesome.
Yeah, they do a really good job with those.
Yes, so if for no other reason, I mean, the fact that you're saving lives is certainly one thing, but even if it's just to get that awesome t-shirt, then by all means, consider donating blood. And I will say, I know there's a lot of people who are nervous about donating. Maybe they never have before, but let me speak from a blood donor myself. I had the same concerns, when I first went years ago. But your staff, Brian, is amazing. It honestly does not hurt at all. They're so friendly. They make it very easy on you. And the fact that we have a center right here in Cartersville that you can go to, you don't have to wait till you see the blood mobile somewhere, is really fantastic. So I just want to give kudos to your team because they do a phenomenal job and encourage everyone to consider that. Yeah. Well, and on that note, one of the things that you recently unveiled was a QuickScreen app. And so I know some people say, it takes a while to go through the screening process once I get there and they go through. But how cool is it that you save us time with a new app? And so I want to give you an opportunity to tell our viewers about the QuickScreen app.
Absolutely. People can go to our website and access the app, or they can go into the App Store for their either Android or Apple. Pick up the app there. The app is called QuickScreen. It takes you about 5 minutes or so to go through the questions on your own. And then you can do those questions anytime from midnight of that day till the time you come to donate. So somebody can go ahead and complete that portion, which usually takes about 10 minutes in the center to complete, and then cuts down the wait time. You're not waiting behind somebody as much because people are completing it. So it's been a real blessing for us to have that. And we're really looking forward to when we get back into the swing of doing blood drives with churches and those kind of things as we're coming up to be able to go out and be more effective in those environments where people are in a rush. If you go to a church on a Sunday, people don't necessarily want to hang around for a couple hours to give blood after church. I mean, my pastor always says that the roast is burning, at noon, and so it's time to go. So we want to get people in and out. So it's a great opportunity for people to pre-register, to get through that kind of arduous portion of the collection process and get you into the collection much quicker.
Perfect. Yes. So we highly encourage. I highly encourage people to do that. It's very easy. So they go in maybe early that morning, fill that out. Then they're going to come into the center to donate. Let's talk about, just briefly, I know when you're talking about a company like Blood Assurance, all the safety protocols are in place. But to ease the mind of anyone who does wonder, what kind of safety protocols are in place, talk about some of the things you all have done differently to make the environment a little safer.
All of our employees now are wearing masks when they're in contact with donors. We, of course, have been wearing gloves with donors, changing gloves in between donors, those kind of things. But now we're cleaning every touch point that a donor comes in contact with in between every donor. So if a donor goes into a room and uses our screening materials, we're cleaning those. If we're handing them a pamphlet that's reusable, it's being cleaned. The donor beds are being cleaned between every donor. So we're ensuring that in between every donor, we're touching all of the touch points on something. So, and you may not even think about, but a chair, for example, people touch the undersides of the chair. And so we're making sure to wipe those areas even where people might touch. In addition to that, we've hired a cleaning company that comes in once a week that does a deep clean, and then 2 days a week in all of our centers and all of our mobiles, we're fogging the equipment. So we're going through with what's called a dry mist fog, and it's a disinfectant, and so we're spraying that over all of our materials, all the beds, all of our equipment, etc., to try to prevent any cross contamination.
Fantastic. Yes. So it sounds like a very, very safe environment, which is wonderful. One of the things, Brian, that you recently mentioned in a virtual event that we were attending together is this, what I think it's a new concept, maybe not. You shed some light on this, but convalescent plasma and how it is helping COVID-19 patients. I think this is very interesting. So I want to hear from you and share with us what this means.
Yeah, well, convalescent plasma is plasma taken from people who have tested positive for and had the coronavirus or the COVID-19 virus, who are now free of the COVID virus as far as the antigen tests are concerned, but they have built up antibodies in their blood. And what we're doing is taking the plasma from those people that contain those antibodies and then being able to ship that plasma to hospitals, and they can give it to very ill people that are ill from COVID to help them build up antibodies in their system. And one of the things that, we've seen a lot of anecdotal information from various hospitals, Cartersville Medical Center included, where we've had patients there that were in the ICU on ventilators, etc., who were actually taken off the ventilator, discharged from the hospital in less than a week. So it's been phenomenal to see some of the successes we've had. It's like anything in medicine, you're not going to save everybody. It's not going to be something that's going to be absolutely 100% for everybody, but nothing is. But the promise that we've seen with this has been very, very positive. And we have, through our community, been able to help about 700 people in our community and additionally across the country. So we've helped people as far away as Washington State, people in Baltimore, Maryland, Detroit. So people from our local community have come together and helped save lives all over the country. So it's just been a phenomenal thing for us. It's been wonderful for our staff to be able to get such direct feedback and see that something that we're doing, something that our community is doing, has such a positive effect on our own community and communities across the country. So anybody who's had COVID, who is at least 14 days free of COVID can sign up and see if they're, as long as we can get the attestation form from their physician, those kind of things, then they can become COVID-19 convalescent plasma donors. We'll take a unit of plasma from them. Generally speaking, it's about 825 milliliters. We'll break that down into 4 different units, and they can help 4 people with that 1 unit of plasma. So it's just been phenomenal. It's been wonderful to be involved with it. And like I say, I think, we know what we do is very important and that we're saving lives every day with blood, but we don't often see the other side of it. So we don't often get the direct feedback that, hey, this saved my life. And in this case, we're getting that from people. And so it's been very rewarding for us. And people can go to our website, bloodassurance.org. It's right on the homepage. There's a banner. They just click on that banner, fill out some information, and then our nurses will get in touch with them, get in touch with their doctor, that kind of thing. We can get them signed up. Additionally, we're doing a convalescent plasma drive at Liberty Square Church on June 12th from 9 to 2. Anybody and the reason we're doing it there is because they were looking for a way to give back. Obviously, that church was devastatingly affected by COVID-19, and it's an opportunity for them to take something that tragic that happened to their church community and turn it into something positive for the community. And so we support that wholeheartedly, and we're very excited to be involved with them in that regard. So again, people can go to our website, register there. The nurses will get in touch with them. We'll get all the paperwork taken care of and get them an appointment as quick as we can.
That's fantastic. Yeah, so 1 convalescent plasma donation saves 4 lives. If I recall correctly, 1 blood donation saves 3 lives.
Correct.
So, and the process again, guys, it's so easy. It's very comfortable. I cannot encourage you enough. Please, please, please consider this, especially during this time. People always want to know, how can I help? In a community like Bartow County, everybody wants to know, how can I help? This is an easy way to do it and a big, meaningful, impactful way to help. And Brian, the one thing that I want to make sure that our viewers understand, and again, please correct me, I'm going off of memory here, but I don't want to speak for your organization, but if I recall, Blood Assurance is the sole provider of blood to Cartersville Medical Center. Is that correct?
That's absolutely, yes. Since 2002, Blood Assurance has been the sole provider of blood products to Cartersville Medical Center.
Fantastic. So once again, we hear this term, we're in this together and we're supporting each other. Again, what a great way to do so. Brian, I want to thank you so much for joining us. This has been fantastic information. I hope our viewers will love it. They'll learn from what you have shared and they'll go and take action. We'll be sure to provide the links to the website as part of this video series, so it makes it very easy for people to access. And thank you so much for all that you're doing to keep us healthy and well. Thank you, Cindy. We appreciate it. We appreciate all the chamber does. Absolutely. Take care, Brian. All right, you too. Goodbye.